How do you do a lip enhancement with a cleft lip?
So cleft lips are unique. So they're a little bit like any scar. Each one needs to be assessed differently. The ones that I've treated, the most common issue that you face is that there simply isn't room where the scar is to expand that much. So you're trying to gently nudge the tissue in the right direction in those places where there's scarring so that you can kind of smooth any imperfections, just to make them look a little bit fuller. But if this is true with any scar, by the way, that if you then add too much volume, the scar may not release its tension on the tissue as well as other tissue does. So effectively you have a tight band where the scar is, and that does limit how much volume you can put in, but that's true with any scar. And the most common I do see on lips is a cleft palate that's been repaired, a cleft lip. And so you just have to do things slowly and look at it as you go on. You can't do a treatment plan and just apply it. You need to get that feedback while you're injecting to see how it's going to go. And of course, you need to consent and consult your patients well so that they understand the limitations. But you can definitely make a really good difference. I've done loads in the past that have made a lovely difference to patients' well-being, and I'm sure you can do that. So it's certainly not a contraindication. Some people think it's a contraindication, but you do need to think carefully and go slowly. So hope that helps.